Happy Friday! Welcome back to Things You Ought to Know podcast. I'm your co-host, Kelby Finati.
And I am your other co-host, Erica Arnautovich. Today we are having Dr. Tay on, so we are both extremely excited to get a chance to talk with her. For those of you that don't know, she is a licensed psychologist. We'll read her full bio in just a minute. But she also diagnoses autism. She comes the at the whole autism gamut with more of a family approach to it. So it's a really cool, unique approach. She was a sibling of a child. Her younger brother had autism. So yeah, there's like a little mini bio of her. I'm a fangirl, obviously.
Same.
Yeah. So we're so super excited to get a chance to talk to her today. But yeah, before we go any further, I will say full disclosure today, guys. Okay. One, we have our third business partner that you guys have like already unofficially met, Parker. He has lots to say today right now. He said, yeah. So he's awesome. And we have two of our other children here as well. So we have Porter here, so you may hear him. And we have my oldest daughter, Zara, here. Luca is at therapy. So 3 out of our 4, full-time kiddos we have right here today. So we are doing the best we can. Bear with us.
Yeah. I think that gives note to kind of the week that it's been already. It's a Monday. We always record on different days, but today's a Monday for us.
Yeah. So yeah, we look forward to the week ahead. I can't do another week like I did last week, so somebody else is going to have to take one for the team this week.
Not it.
Yeah. You've had your share. I've had my share. I don't know who it's going to be, but it can't be one of ours. So yeah, but
we'll go ahead and dive in with Dr. Tay, and we're excited for you to get to hear the interview with her, and let us know if you have any questions. I'll put her information down in the notes below so that you can be able to quickly find her on social media where she's very active. So, we'll go ahead and dive in. All right. Well, we are excited to have Dr. Tay here with us today. Erica and I originally met Dr. Tay at the Connect Strong conference in Charlotte back in April of this year. Yeah. She had a very memorable breakout session for me.
Same.
She has a very peaceful voice and calmness to her that she got us in like this calm state. There were some tears shed during the breakout session. So we are very excited to kind of pick her brain today. Before we start our conversation, though, I'm just going to go ahead and read a little bit about Dr. Tay. She is a licensed psychologist specializing in neuroaffirming care for autistic children and their families, including early diagnosis and early intervention. She has a PhD in clinical psychology and is the CEO and founder of Dr. Tay Concierge Clinical Care. Her practice integrates the whole family approach, a process she created utilizing evidence-informed principles after seeing a gap in autism care. Her passion for child psychology and her focus on autism is in many ways tied to her own personal experience growing up with a brother who was diagnosed at 23 months of age. So that was something that we related a lot to Dr. Tay on, is wanted to kind of pick her brain today from the siblings perspective, and then we had a listener question, so we'll go ahead and ask you that too. But welcome, Dr. Tay. We're excited to have you on. How has your day been so far?
It's good. And thanks so much for having me. I'm excited for this conversation. And a little cool full circle is when I was at Connect Strong, I stayed longer and decided that I will be relocating to Charlotte, North Carolina. So it's cool to hear. Remember, that's where I connected with y'all and, have that come full circle. So I'll be in your neck of the woods soon.
Well, we cannot wait.
We'll happily welcome you with open arms and maybe an espresso martini.
I love espresso martinis. So perfect.
Okay, good. That's my favorite too.
I haven't had one. I feel like left out right now. I've never had an espresso martini.
I
Oh,
am
they're good.
shocked. Oh, okay. Well, when we take you out, when you get here, we will give you an espresso martini.
I'm like a tequila girl.
It should be a little dangerous.
Me
Are
too.
you a tequila girl?
I'm a tequila girl, but I will say I love me a espresso martini. So
Yeah.
Perfect. Okay.
Yeah.
Good. Well, I'll do the tequila and then you can introduce me to espresso martini and we'll all do the tequila. Tequila, really. So yeah.
Well, we would love to kind of dive a little bit. I mean, your bio gives a really good overview of kind of who you are, but from the siblings perspective, I'd love to kind of pick your brain a little bit more. Erica has an older daughter, and who is neurotypical, and then her son is diagnosed with autism, and then my oldest is autistic, and my youngest is too young to know yet, but he's presenting neurotypical so far.
Yes.
So you want to ask? I know you were kind of really eager to ask some questions.
Yeah. Yeah. So I wanted to know because I just wanted to see from your perspective as this. Now, was your brother older or younger?
He's 10 years younger than me. So I was 12 when he was diagnosed. Yeah.
Okay. Okay. So did you ever experience like frustration towards him, anger towards him? Did you feel like your parents poured a lot more energy into him? Resentment? Like, did you have any of those feelings?
Yeah, I mean, I definitely think so. I think they were much more internalized though than externalized in the sense that no one ever told me this, and I said this in the presentation, but it's kind of, something I think that rings really true is I knew my brother needed support and help. And sometimes with kids' brains, they understand things in very black and white ways. And so in my brain back then, it was like he needs more support than I do. He needs more help than I do. Therefore, I can't need help and support. And no one ever told me that. It was just something, again, that black and white thinking of realizing, we had therapists in our house for a period of 2 years for about 45 hours a week. So, a lot changed. And so obviously I was getting all of these data points that he needed help. And again, that black and white thinking led me to thinking that I then shouldn't need help. And obviously that is not the case. My adult brain can understand that now. But I think because that was the underlying narrative, I actually didn't have a lot of like outward anger and frustration, but more just trying to dial back my own emotions and not try to take up space. And I think that, those are things that I'm processing now as an adult. I go to therapy myself. And I think one of the things that I feel so focused on trying to help families proactively navigate, although I say this a lot, it's never going to be fair, right? And I think it is really recognizing and accepting. And that's some of the grief process too, is that not only has your autistic child's life changed and how they're going to navigate the world, but also recognizing at the same point that your neurotypical or non-autistic children's lives have changed too.
Yeah, absolutely. That's been really hard because like as the mom, I definitely have poured so much attention into my youngest, trying to get him all of those things that he needs. He needs more help. So just recently, I feel like I'm getting back on track with making sure that, my daughter is getting everything that she needs as well. But that took a really long time and a lot of mom guilt there. Was there anything that you felt like, and like, this is totally for me.
Yeah.
I hope some listeners get some insight from this too, but this is totally for me. No, but is there anything that you felt like your mom or dad or like, any other family members could have done better for you, that they did really well for you? Is there anything that you kind of like looking back on it now with, like you said, your adult brain kind of wish things were different, or like that you can look back and they did a really great job with this?
Yeah, I mean, one of the things, it took me a while to get here. I think some of my own process of this, but is recognizing that there were things that my parents could have done differently. And I felt a lot of guilt for that for a while because then I was so worried that that would mean I was telling them that they did a bad job. And that was far from the truth. But what I now can realize and reflect on is they were doing the best they could, and at times it wasn't enough. And what I also recognize, I think being on the professional side is how little support there is for parents. And so if there's this little amount of support for parents, then also trying to help their non-autistic children navigate through this process and journey is really, really hard. And so I think for you, Erica, but any parents listening to this as well, is holding space for that too, that this is hard and you're not going to get it perfect. And so I think for me, one of the things my parents did really well is made sure that I still could live my life, right? So, I remember, for example, they ended up hiring like basically a babysitter, and the babysitter was less for my brother and it was more for me and to transport me around and make sure that I still could get to all of my activities and be able to participate in things that that I wanted to. And I think that some of it is like that was really, really important, is that still was a priority for my family, and that I was being supported in that way. My mom has, and I have my own podcast. It's called Evolve with Dr. Tay. And I actually interviewed my mom on the podcast. And she talks a lot about having a lot of guilt that she couldn't always be at everything. And yeah, there were times that it was hard. I would put on a pretty brave face though, of like, no, it's fine. I understand like why you guys can't be here. And that was hard. And I think the biggest thing is less that my family couldn't always be there and more that we didn't always talk about it. So I talk a lot now. It's less about the quantity of time, more focused one on the quality of time, but also focused on the repair aspect of it and making space for these emotions, having these hard conversations. And so I think, Erica, even for you, is like, I would express some of that to your daughter in a developmentally appropriate way. Create space. Like, what was that like for you? Asking these questions, getting curious, and modeling for her that it is okay to have these negative feelings that are coming up. Like, you can have negative feelings. That doesn't mean you love your brother any less. And that, I think, was something that could have been my parents could have been more effectively supported in, and then they would have been able to, in turn, more effectively support me.
That's a really good point. That's a really good point. I think sometimes as parents, it took me a really long time to say that word to her, to say autism to her. I think it was almost a year after his diagnosis, actually. I just kept saying he learns differently. He learns differently. He sees the world differently for a really long time. And then finally I said that word, and I don't know what, I mean, for me, it was like really, really a big deal. I mean, I remember exactly when, where, everything when I said that word to her for the first time. And her reaction was the same. That's when I had just said he learns differently. And I'm like thinking there's going to be this big, like, I built it up in my head to be so much bigger than what it was. One thing I've done too at her school is I've sought out for her to go ahead and just have a counselor there, just available to her, because I felt like sometimes if she couldn't talk to me or my husband about it, because we're going on the roller coaster as well, I wanted her to have somebody safe that she could talk to. Do you feel like that is something that is a beneficial thing for us to do? Or is that, I always thought like, am I projecting my feelings onto her? I don't want to be doing that either, but
yeah, I mean, I think it's helpful, and I think it's about taking their lead in it. Do they want to participate in that? Do they want to share? They might not want to, and that's okay too. And I think, I just to name this, Erica, some of why it was so difficult for you to say it is you were going through your own grieving process with that and getting to that place of acceptance. And I think some of it is that I always say parents have to go through it first before they're introducing it to their child. But what I love that you did there is you introduced the concept of neurodiversity early, often, frequently, even if you weren't ready to say the word autism. And I think that is where families can start. But yes, parents have to go through that grief process themselves. And just to be clear, because sometimes there's controversy around this idea of grief, is you're not grieving your child in any way. You're grieving, the shift in expectations. What you don't realize is when they were brought into this world, you had a lot of subconscious expectations thinking about what their life would look like. And so it's shifting those. It's also grieving that although we are seeing movement towards more acceptance as a whole in our world isn't always positioned for, a neurodivergent or autistic individual to navigate it. And so there's grief with that and grief that life is going to look different. And so I think parents have to go through that journey themselves before they're going to be really ready to start to bring in some of that language. And it's okay to give yourself that grace and give yourself that time to be able to process.
Yeah.
Yeah, we both, you said it was, you hit the nail on the head saying that the grief word is controversial because we had that conversation with our husbands and they both don't, quote unquote, believe in the word grief. They see it differently. But Erica and I relate on the mother standpoint because we identify and know exactly what that grief process looked like for us and are still on that in that process and walking through it. So I wanted to kind of piggyback, if you don't mind, a little bit off of the conversation of there's a controversy that comes along with in the community with parents of, do you tell your child they're autistic or do you tell the sibling that they're autistic? Do you tell even just the child alone, that conversation sometimes is controversial. I've heard it both ways. Some say they don't want to, quote unquote, have a label on them and tell them. And then I've heard vice versa. So do you have like a general, I know it's probably, you can talk for hours, I'm sure, on it because there is so much to say, but I think you already were talking a little bit about it by just introducing neurodiversity into their world, maybe if it's not saying the name, but any other tips and tricks that you have for families on that topic?
Yeah, I have a pretty strong opinion on this that we should be identifying the word autism, talking about it often, not avoiding it, because the reality is I think there's a few pieces of this. Is number one is a lot of autistic adults describe that they knew they were different and they didn't have the language because there was less acceptance back then when they were navigating it as children. And I've heard numerous autistic adults, adult after adult, say the only thing that they wish is they would have known sooner, not that they wouldn't have known. And I think we need to be listening to those voices and, really recognizing like that is a roadmap in some ways. You don't always get a roadmap, but autistic adults can really help us figure out kind of what are those next best steps. The other piece, and I say this gently and supportively and kindly, but if a parent is really fearful of a label, that means that they just haven't gotten to that place of acceptance yet. And they haven't gotten to this place that understanding that their child's brain is wired differently and that they do have more support needs. And that just is an indicator to me to kind of lean into that. But the other piece of this is autism doesn't have to be this like bad word. This thing that, yes, it is a disability. Yes, there are more support needs. But what we've seen historically and this is this difference of like medical care as opposed to neurodiversity affirming care within the medical community, the way we diagnose autism is based on the deficits. And so for so long, we were so focused on those deficits. And what we have to realize is that all your child's gifts and strengths that come with it too, that's part of their autism. That's how their brain is wired. And so I think that, naming it brings it to life and shows that your child is accepted for who they are. It gives them words to be able to navigate this journey themselves. And I think, ultimately it's a journey to get there. And so if you're not ready to say it right now, that's okay. And just connecting back to the grief piece, I understand your husbands have a different perspective on that. And I think sometimes it's the word grief, but when we actually look at the stages of grief, there are so many similarities that happen, and some of that sometimes is denial as part of this, right? And so not wanting to label your child could be this piece of denial, or it could be this piece of what we call bargaining, where it's kind of like, well, if I just don't say it, or I position it in this way, then it makes it better. And that's just all part of this emotional journey that you have to go on to get to a true place of acceptance.
I love that information. Thank you for sharing that. I personally can relate to that because there's an Instagram account, and I hope I'm saying the handle correctly, but it's Autism Out Loud. That Instagram handle has really helped me feel more comfortable with literally autisming out loud with my son. It's like, and if I share, like, with my husband and I, if Porter stems in the Target parking lot or in Target, we're stimming with them. We are going to do it. We're going to show the world who he is and, like, have that acceptance, be forthright with it. But I do have, there's some people that I know within this community that see it differently, and they see it with the label, or they're on the other side of it, as far as, like, it's a little bit more of the hush hush conversation within their smaller communities. And what I've seen the benefits, my son Porter, was in those settings. If I can just go out ahead, because I am his voice right now, he has an AAC device, but I'm usually the one that is introducing him into peers situations. So we were at Vacation Bible School. And it's kind of like a little camp here in the church. And so I introduced him to his peers that he was going to be with the whole week. And I let them know he's autistic, asked if they have any questions for me about what that means for him. I told them, like, some of his little quirks that he'll do. You might see him hanging upside down. He has really good balance. He won't fall, I promise. And kind of get them used to it. And for me, it helped not only give me peace of mind that people were understanding him, even at the kid level, but also the adults that were with him that week. But then also that, just for the children to have awareness into who he is. So he's not, and I say this, hopefully no one takes it the wrong way when I say this, but he no longer was being viewed as the weird kid in the corner. They understood him better because he is autistic. He does this. Oh, that's how he communicates. Okay, he may not want to play and color with me. Instead, he wants to peel off every piece of paper and peel it into 100 pieces on the floor so that I have to clean it up. But it allowed like you had said, it created a pathway for people in general to know how to navigate our children. And that's truly, personally, I've experienced that. It created a pathway for them to know, like, he's not the weird kid in the corner. He's not trying to ignore you. He hears you. He's listening. He is engaged, but it's just in his own way.
Absolutely. I think, one of the things is we get hesitant about labels because, one, of all the stigma attached to them, but two, there's fear a lot of time. And if a parent is listening to this right now, what I want to say is your fear is valid, and it is hard, and it's okay to let your fear be here. And at the same point is exactly what you're describing, is where, it allows us to see things in different light. And when we just accept it and speak openly about it, it embraces those differences. And while our world is becoming more affirming, we are seeing less stigma. There still absolutely is stigma. But one of the things is unless we're talking about it, it's going to be hard to progress that acceptance. And I think that, ultimately just naming it for what it is, it's helping these kids build their understanding and actually truly get the opportunity to practice more acceptance. And I think it just like really is the definition of neurodiversity affirming approaches of like talking about it, talking about differences. And if you're not there yet, that's okay. You're not wrong for your perspective. And I invite you to sit with some of that discomfort that maybe you have in naming it and digging a little bit more deeply as to why and what you think the outcomes will be. And I think when you can work through that process, what you ultimately see is there's so many ways that actually naming the autism can serve your child, can serve your family, can serve your community. And while the burden is not always on you to explain to everyone what autism is and be the ultimate educator, I think it does help to model for your child, your autistic child, how they too can talk about their own differences as they, learn to navigate the world. Again, whether that's on AAC or they have the spoken language or other forms of communication, every time you're talking about it, you're being a model and helping them to build those self-advocacy skills.
Yes, so many good points there. For sure.
The word that comes to mind for me just initially is empowerment. It gave me empowerment to be able to explain who he is. And then it also empowers my son to be okay with who he is and to come out right and just be proud of, he's autistic and proud of it. I mean, he is just, I'm biased. He's just the cutest thing. And when he has happy hands, and I think those are some of the most like precious things about him that I think when other people see him and then see him better in that light, in his unique light, it creates a space of empowerment for all, because now other people feel empowered to ask me questions, and then I feel empowered to answer those questions. And so I think that's as you were speaking, that's like the word that just kept coming to me was empowerment.
Yeah. I love that. I completely agree. I think that, like we had talked about in the diagnostic, I diagnose autism in my pediatric clinic. I'm a medical provider. So I think, but one thing that you said when it came to like medical diagnosis is the diagnosis is, formulated from the disabilities, from their weaknesses. And I always like to phrase to parents, every person has strengths and weaknesses. But I love how you focus on their strengths. Like not focus. I mean, you have to give the diagnosis when you're doing your diagnostic process, right? But, I was telling Kelby and, our listeners when I kind of walked them through my process that, I always, once I give them, I do like the positive sandwich in business. I don't know if it's just in business, but where it's like I give them their strengths and I let them know that like this kid's amazing. I kind of give them the bulk of like, hey, this is what formulated the diagnosis. This is kind of what happened, what I saw, what we need to work on. And then, but at the end, I always kind of like to bring them, like leave them on a high note. But like one of my favorite things was, a kid with stereotypical, stereotype speech, wanted to elope the room. So nothing really to do with the ADOS itself, but he just wanted out. And he went like to infinity and beyond, like loved like Buzz Lightyear. He was totally communicating. I knew what he meant. He knew what he meant. We all knew what he meant. And I like wanted to end that with that mom, that was probably like one of the most memorable, cutest things I've seen, So, but, like we talked about, the floor kind of opens up as the parent when you give that diagnosis, even if the parent was assuming that was going to be the diagnosis, but kind of like giving them the empowerment to like, let's open up the floor in a different way. It's kind of like what I kept thinking is like the floor opened up and you're falling when you hear the diagnosis. but giving a neuroaffirming, community to these families and these children, we're opening up a floor for them to like have their voices in whichever way they communicate. So I really loved that. And I was thinking like, I think the same idea, but I was like thinking of it in like a total different, like I had like this image going in my brain.
Yeah. Yeah.
So
Yeah. I mean, there's still, like, to be candid, there's still all the emotions that come with this, right? Is like, I always say, things that I say as part of the diagnostic, process is I actually will pause and say, okay, it's one thing you come into this evaluation with me today and you're looking to see if your child's autistic, but what's it like to actually hear someone confirm that for you and creating space for those emotions, but also recognizing that when your child walks out of that evaluation, they haven't changed at all. It's just that you've changed now. You now know how to support them. Your understanding of them has changed, but your child themselves actually hasn't changed. Their brain has always been wired this way. And so I think, diagnosis, if, especially if families are listening of like, even like, do they want the label? I think that some of it is like diagnosis can be a roadmap in helping to understand your child. And neurodiversity affirming approach is going to talk about the strengths as well as the support needs and just helping you to holistically understand who your child is.
yeah, I love that.
And
I love that. I don't think enough clinicians, and I think it takes like, we've talked about before in other episodes that, the siblings of children with autism are really end up being super special adults. And you're certainly fall in that category. And, I think I sat in a very unique position being a pediatric nurse practitioner prior to my son being born and diagnosed, and, kind of started my program after, kind of in an advocating way for him and other families. And, I think that as you walk that journey, it's really important to just understand how unique your position is. So all of your thought processes on this, like I can tell you as a mom, I'm sitting here, and as a diagnostician, I'm sitting here and going, she gets it. Like, I'm going to make you be one of my best friends now. Because there's so many diagnosticians that are lovely and they're great humans and they're doing a wonderful service. But there's a better way sometimes that we can deliver this. It doesn't, like I said, it doesn't have to be doomsday for these families. Right. It can be, we need support, but like you said, let's give you the roadmap to your child. Every child is unique, but that roadmap that you're offering and the way that you talk to them and you're giving them that space to have all of their emotions, it is so amazing and beautiful to me as a mother and a provider that I just want to thank you so much. And I am so beyond excited in so many capacities to have you in the Carolinas, because I can tell you we need you. Mm-hmm. Like, we need you bad. So I can't wait for you to come and be a voice over here.
Well, thank you. Yeah. And I think, it's been a journey to get here too. So if there are providers who are listening to this, like, you can pivot and change at any point. Like, I was in academia literally until 2 years ago, had planned to do autism research, like never planned to be a clinician. Obviously I have the training as a clinician, but I was like, I'm not going to do clinical work. I'm going to be in the research space. And then when I started to learn about neurodiversity, and I missed that contact and really having direct impact for families. I was like, I'm going to do this different than what is traditionally done. And there's been a lot of learning and evolving through this process. And letting go of ego too, right? Like, the way that we're trained, there can be so much ego tied to that, and like your identity tied to that as a provider of like, but I know this is how I'm trained. This is where I spent so many years learning to let that go. I think it's part of this journey as well. And it's not always easy. And there's still times that I'm like, oh, okay, I didn't like how I said that. Or, someone will call me out on social media and it's like, okay, I can learn and I can evolve. I don't need to be perfect right now. I just have to learn how to listen. And that includes for me listening to autistic voices all the time. And it also includes really listening and empowering parents, realizing that parents are the experts of their children. And, I really view that any work that I do with families as partnering with them, and not this hierarchy where it's like, I know better.
Yeah, we went into my journey, and I talked about my experience with the diagnosis day is what we called it. And it was not easy. The provider had no kind of compliment sandwich or positivity. She just focused on the negatives and the deficits that were presented to her that day. But so I'm so thankful that not only from just the parents' standpoint, that there's other parents that are coming on to this journey, and they're doing it in better, more capable hands. So thank you both for putting your own spin on it for parents, because that's it's already an exhausting day, and then an emotional day at that. Um, so we had a listener ask a question that I don't know how to answer, and maybe Erica does. We haven't had time to really talk about it, but I really think you're the right person in the right seat to go ahead and pose this question to. So in the realm of speaking how like autism out loud, and then also, because once you know and understand autism, you can pretty much, like, I am not a diagnostician in any sense of the word, but pretty much when you go into Target, we say like the characteristics of autism, if they're prevalent, you can pretty much say like, oh, I identify with that mom over there. And so we had a listener that posed the question of, if you can highly suspect that a family member is autistic and not diagnosed, and you don't know how to have that conversation with the other family member, the parent of the child, what's the best way to approach that? Do you even approach it? Is it within is it the right thing, the wrong thing to do by even posing the conversation to the parent? So we'd love to kind of pick your brain on that.
So I think first taking a step back of like, what is the purpose of bringing up this conversation? What do you hope to achieve out of it? And getting clarity there, I think, can be helpful. And also recognizing it might not go at the pacing you're thinking it will go at. And so it's about, if you choose, to introduce that conversation, that there's no attachment to the outcome in terms of how the person will respond. They could respond in a way that is like, absolutely not, you're wrong. They could also be like, yeah, I've thought it for a long time, and then there's a million options in between that as well. And so going into the conversation with no expectation about how it will go, but I think getting curious is the thing that I would do. And I think getting curious is like, just talking about, for example, with your child, how autism presents, or, asking how much they know about autism. And then I also think in some ways too, modeling vulnerability, right? It's not like, hey, this is what I see in you. You might even say, like, these are some of the traits of my child that I relate to. Have you ever related to those? And of course, make it true. And that's the thing with autism and, the traits that we're looking at is there can be overlap for varying reasons that aren't autism. And so if you can honestly have that conversation and modeling it in a vulnerable way, I think it creates an openness and a dialogue. And I think you could ask, what that person knows about autism, and, if there's anything that resonates with them, but being okay that if they say no, that's their own journey that they need to go on. And I think also like sensing the temperature of the conversation. So if they're really like absolutely not, then I wouldn't continue to bring it up. They might need to do some internal behind the scenes processing they don't really know much, but you still see them being curious. Like, you might reintroduce the topic at other times and realizing, again, you had to get probably to the journey of accepting that your child's autistic. And for a person themselves, or for if it's like for their kid, it's going to take them some time to get there too. So it's often not a one and done conversation.
Very helpful. Thank you. I'm sure that's going to give them a lot of different tips to be able to
Yes.
navigate that conversation when and if they feel like it's appropriate. Like you said, temperature gauging is, I think, the first line of action is to make sure that they're, because I will say as a parent, when I'm in crisis mode, I can't take on any other kind of conversation. So if like they're, I would recommend from a parenting standpoint, if the child is melting down, having a complete meltdown, that's not the most appropriate time to say, oh, my child has meltdowns like that.
Yeah.
Maybe yours is, that's not the conversation to have at the appropriate time. So, definitely temperature gauge is, I would make sure they do that too.
Yeah. I always love to say as well, that, because I have patients, I'm sure you do too, of like the family member doesn't, or, believe that they have autism or something like that, but I often will say, that like a mama gut is real. Like that parent knows something is unique or different about their child. Whether they are ready to speak on it, like you said, gauging the temperature is, so bringing that to them, over and over again, it has nothing to do with, they probably know something is going on. It's they are not ready. So, kind of understanding that part is really huge, right? It's just, and just being, like you said, like you have to just kind of be okay with like letting them walk their journey.
I think, with some of it is I have interviewed people on my podcast that have said like someone else was brave enough to say something to them and it made all the difference in the world, right? Like it got them going down this journey. It made it feel real. Because the other side is behind the scenes, sometimes this parent can be concerned, but then they're being told over and over again, like, oh, it's all in your head, or I don't see that, whether it's from their partner, whether it's from a teacher, or I mean, commonly this happens with pediatricians, and so I think that's the other piece that you don't know about this. And so, and I think, if you're speaking parent to parent, like about your kids, you can start to share some of the things that you notice. I think in some ways that sometimes can be a good entry point of like, yeah, these are some of the things that I noticed in my kid. Have you ever noticed those? Or sometimes even asking the concept or the question of, what's your conceptualization of autism? What do you know about autism? I think there's a lot of limited information out there too. And then, yeah, but I think that also, like, if it's the adult, like it's someone in your family at the adult level that's exploring their diagnosis too, and if they may be autistic, super common. And I think there's more and more conversation around that as well, is, I think pointing them, and actually even for parents too, pointing them to social media can be a great resource sometimes, of being able to listen to people who are a little bit more displaced and educating about autism broadly or talking about their lived experience.
Yeah.
Thanks for that. I wanted to make sure too that we get into our last segment, which is we always ask our guests, what is something that they think the world ought to know about autism? So in whatever capacity you want to answer that, we'd love to pose that question to you.
I'll do this one. So, I think one of the things to keep in mind is that autism is a lifelong disability. And we can see these traits ebb and flow. over time. And so I think that's important to keep in mind, that there are going to be some phases in your child's life that feel more challenging. You're going to feel like you are completely in the thick of it and you're never going to leave that spot. And those are hard moments, and giving yourself grace in those moments and making sure, easier said than done. And I talk about this a lot, but taking care of yourself in that too, because in those moments where it's really hard, more likely than not, your autistic child needs to co-regulate with you, which means that you as the parent need to have a regulated nervous system. So giving yourself grace there. And then there's also going to be times where things will flourish. Things will feel easy. Your child's going to make gains. And so on the other side of this too is, sometimes too, like there still is conversation where it's like, well, should we remove the diagnosis? And I think recognizing that things are going to ebb and flow, that there's transition points, that things often get more difficult, and recognizing this is how your child's brain is wired. And so sometimes they're going to need more of those supports, more of those services than other times. And in those times that they don't need them, it is okay to dial back too and say, hey, my kid is really thriving right now. I'm going to give them more capacity to be a kid, and not just in a ton of intervention and therapeutic support services too. So I think just understanding how it can ebb and flow, whether that's you're in the thick of the hard right now and realizing, it will get better, or things are going really well and maybe you're making decisions, yes, autism is still there, but you don't need to be doing everything 24/7.
Ooh, you mean I don't have to do everything 24/7? I need to take that advice for myself.
I know. I think you just took me on like an emotional roller. Take care of myself.
It's complicated, right? It's not always that easy to be able to just say, I need to do this. And it sometimes feels selfish, but also this is what your child needs too. And so it's not selfish, and you need to feel regulated, and you need to be in this for the long haul. And that includes taking care of yourself. And so it also includes getting creative with how that looks, what that looks like, because it's not as simple. Sometimes, I have families whether they literally can't get away because there's no one to watch their autistic child, or if they do, that then they feel all the guilt and shame that they should be at home. And so there's so many different layers of this that come into play. So it's not as easy as just self-care. And it's still important to go on that journey.
Absolutely.
Yeah, my husband and I have had to get creative with date nights and stay in date nights and things like that, because it's hard to find, like you said, it's hard to find care. And then when you do have care, it's hard to separate the mind from not being there with the child. So.
Yeah, absolutely. Yeah.
Well, Dr. Tay, can you tell our listeners how to find you? And I can also link your information down in the comments or in the information section of the podcast. But could you? I know you're active on social media, and I love that about you, because I already feel like you're a friend, because I can follow your in and outs, and you give so many good nuggets of information, just like you have done on today. So if you could kind of plug your social media, and then also your practice too.
Absolutely. So I'm the Dr. Tay, DR, but it has periods in between. So the period DR period Tay, on pretty much all things social media. Instagram is where my main place of hanging out. And I love being able to share and provide educational information there. I also have a podcast called Evolve with Dr. Tay. I think I'm up to episode 119. It's been a labor of love of just trying to help parents navigate this journey in a way that is neurodiversity affirming, but then also is supporting the whole family. So I love being able to do that. And then in terms of services, My website is drtaylorday.com, just Dr. Taylor Day. And I do diagnostic evaluations and therapeutic support services, with group therapy being my primary modality right now. And I do that in 40 states. And I am actually getting ready to launch a membership as well, which would be accessible around the world, for parents to get more support and be able to learn more in an in-depth way than, is provided through social media and the podcast.
We really appreciate your time and just your knowledge that you've shared with us and your insight and perspective as a sibling as well. It's been really helpful. I am an avid listener to your podcast, and I can, anyone who's listening to us today, I highly encourage you to go listen to Dr. Tay's. It's so, every episode is just enriched with information and peace of mind too. You leave it feeling peaceful. So I appreciate all that you do for us in the community as well. We really appreciate that.
You're so welcome, and it's my honor, and it's been such a fun journey these 2 years, just like really figuring out what families need and trying to create, education and offers and services that can help tailor to that.
Well, you're doing it, and you're doing it well.
You are. You are. And we're so excited to have you in the Carolinas, soon. So, thanks for coming on, and we look forward to chatting again really soon with you.
That sounds great. Thanks so much for having me.